If you have chronic bladder infections, you do not have an antibiotic deficiency. You're growing bacteria because something isn't working properly in your actual bladder. And one of the most common reasons for this is a lack of what's called estriol, especially as we go through perimenopause, like say 40 on, and all of a sudden you're getting bladder infections. This is not normal, and it's not really about bacteria. It's about like the nourishment of the bladder itself. You need estriol for that. So you have more than 3 hormones. You don't just have progesterone, estrogen, and testosterone. You have multiple metabolites of those hormones. And that particular metabolite is called estriol. So you have estrone, estradiol, and estriol. Estriol is really important for bladder health. And you need to be looking at the entire cascade of your hormones, not just E2 or estradiol. You've got to look at all of them. And if you're getting these chronic bladder infections, especially over 40, it is highly probable that you've got a low estriol. Okay. And so then the reason that that happens is actually going to be upstream in your adrenal glands. And the reason that your adrenal glands get taxed usually is because of blood sugar issues, chronic stress issues, lack of sleep issues. And remember, stress can be bacterial infections, parasite infections, chronic viral, chronic fungal infections. And you know, these happen all the time in our world, right? If you've got chronic cough, chronic sinus infection, chronic skin issues, you've got a drainy, runny nose, allergies, like these are all fungal symptoms, right? So you've got to make sure that those are things that are being looked at, not just treating that bladder infection, especially not with an antibiotic, which now messes up your microbiome and allows fungus to grow even more. And you end up in these chronic cycles of chronic bladder infection. So those are never normal. You always want to be looking at the upstream issues, especially in the microbiome, because that's the foundation for your health. All right, so chronic bladder infections, not normal, right? Taking antibiotics for it messes you up more, and there are natural ways to actually clear them. A couple things that you can use that are really helpful are going to be D-mannose, which will bind bacteria and pull them out. And also making sure that you're looking at your estriol, of course, cranberry juice, the unsweetened kind that doesn't taste good, not the pills, and really like having a healthy microbiome. So hopefully that's helpful. All right, bladder infections, not normal.